Today on Eye on the Desert, I'm very happy to welcome to our program Doug Morin, the Executive Director of the Coachella Valley Volunteers in Medicine. First of all, Doug, let's remind people about the mission of Volunteers in Medicine. You guys fill a really important gap in healthcare here in the Valley.
Yeah, and that's really exactly what it is a gap. There are still people, in spite of Medi-Cal, Covered California, et cetera, there are still people who don't have insurance.
A lot of people think that with the passage of Obamacare and the safeties that we have in place here in the state of California, that's a thing of the past, but it's not.
It's not. Many people, and actually over 60% of our patients are employed, but they're employed often in part-time jobs, and they may have 2 or 3 part-time jobs, so they don't qualify for benefits from any insurance benefits, health insurance, from any one of those employers. But overall, when they go to apply for Medi-Cal, they're earning too much money to get Medi-Cal. Yet, they don't have enough money to be able to pay for it privately, even with the subsidies that come through Covered California programs. So, you know, for our patients, it's a matter of, do they put food on the table? Or do they have health insurance? Do they send their kid to soccer camp? Or do they have health insurance? We have many patients who someone in the family, the primary member, has insurance through his employer, earns too much money to qualify for Medi-Cal or family programs. So other people in the family, especially like a spouse, won't have health insurance. So it gets a little complicated. And what we're there is just to say, whatever the situation is, come and get primary care. If you break your arm, you have a heart attack, that's not for us. You need to go to the hospital.
That's emergency care.
That's emergency care.
You guys are really like the family physician.
Family physician, exactly.
So, and also, we talk about this frequently, a lot of your patients are dealing with kind of chronic ailments like diabetes, managing that, or managing high blood pressure, which is really important to see a primary care physician on a regular basis.
Exactly, and so that's why if you look at our numbers, and I frequently will say most of our patients come in 3 times a year. That's why, because most of those physicians want to see someone when they're stable with their diabetes, or let's say their hypertension, high blood pressure. They still want to keep track of them. We still want to send them for labs, which we pay for free of charge. So that's why we see those. And definitely we want people coming in at least annually just for a wellness check.
Right now, there's a period where you are matching. You have an anonymous donor who's going to match dollar for dollar any donations from $1 to $500 to $1,000. So it's your chance to really leverage your dollars through the end of August.
Yeah, through the end of August, we had 2 donors set up. 2 donors who gave us, monies for a challenge grant. One was an anonymous donor. The other one was Steve Tobin and Jerry Krupa with the Grace Helen Spearman Foundation. Said we'll match dollar for dollar. So the needs are still there. People still have diabetes. They still have hypertension. They still have colds. I'm actually getting a little summer cold myself.
A lot of people are struggling
we still
with that.
need to go to see a doctor. So the need is still there, but our donations always fall, as so many charities do in the summer. So this is an opportunity to turn $1 into $2 or $100 into $200.
You can make a donation by going to cvvim.org. It is an incredible organization. Your doctors volunteer their time, but all the other ancillary needs like labs, like x-rays, those things cost you money, and that's what these donations go to cover.
Exactly, yes.
You have a couple of events coming up in October, the Drag Me to Giving, which is going to be a great fun evening. And then I'm looking forward to November 4th, the Vimy Awards and live auction. You've got some really incredible auction items. I'm going to be serving as the MC and auctioneer for that event. Again, go to cvvim.org. You can find out more about the mission of the organization, who they cover. It is the Valley's only free medical clinic. You have 2 locations now. 2
locations, one in Indio, which is our primary location, and then one in Palm Springs, right across from Desert Hospital.
Right. Important care for the people who need it. And a matching program through the end of August. You donate $1, it turns into $2. Doug, thank you very much.
Thank you, Patrick.
Yeah.